Hi, welcome to Doc Talk. So glad you're here with us. As you remember, Doc Talk is the podcast that's put out by the Knoxville Academy of Medicine that talks about health issues in plain language so that you can understand your health better and you're better equipped to see your doctors. I'm so happy that, I'm Elise Denaney, former president of the Knoxville Academy of Medicine, and welcoming you today to help join me in welcoming Dr. Andrew Singer, who's with Allergy, Asthma, and Sinus Centers here in Knoxville, Tennessee. As you know, he's been with us before talking about peanut allergy, and there was just so much on allergy that we had to cover, we said, you have to come back.
And so here I am.
And so now we're going to talk about allergy that everybody has. Every time you go to the doctor, I know they always ask you, are you allergic to any medication? Right?
That's right.
Every single one. Well,
Yep.
first of all,
everywhere you go, you'll get asked that question.
Yeah. So what do we respond? I mean, I know if I take certain medications, I cramp up.
Right. So that's very common. Some will say, well, I'm allergic to amoxicillin because I had some stomach cramps. That's not actually an allergy. I mean, that is an adverse reaction. It's something that happens, but it's not an allergy. It's not going to cause more than stomach distress.
Right. So we want to make sure that, I guess as physicians, we want to make sure that what I give them is not going to kill them. But at the same time, there are medications which are very effective and beneficial if they can tolerate the side effects.
Correct.
Yeah.
Yeah, so a lot of times, if you do have belly issues, you may have to work around it. That might mean probiotics. That might mean making sure you're dosing it with a food. But those are generally safe, and unless you're getting diarrhea that's severe or out of control or different than you had before with it, more than just minor symptoms, you should be able to tolerate the antibiotic and work around it.
Okay. So if I have a true drug allergy, what is that going to look like?
So a true drug allergy, where the immune system is getting involved in it, basically you're going to have hives which look like small red mosquito bite-like bumps. They're going to appear pretty rapidly after taking the antibiotic, usually within a half hour or so. If it's an injection, it might happen even sooner. It could even be 5 or 8 minutes after injection. You might get some swelling, lip swelling, tongue swelling, finger swelling, for example. Might start wheezing, having what feels like an asthma attack, start coughing. There might be nausea and vomiting with it, but again, this is very immediately after ingesting it, as opposed to taking amoxicillin 3 or 4 days later, my stomach is upset. So it's a very rapid process after taking an antibiotic.
It's scary, and you should probably go to an emergency room if that happens.
Right. If you get that group of symptoms, yes. If it's just isolated stomach symptoms, no. But if it is the skin symptoms and breathing symptoms, or a combination of those, especially the swelling, lip swelling, tongue swelling, that needs to be rapid evaluation.
Okay. And then in order to confirm, I mean, I have taken different antibiotics and never had a problem. And then one time I took an antibiotic, and the same one, of course, and had a reaction, and that was surprising.
Right, and we're not born allergic to antibiotics, but the number of times we get exposed to it in doses, and then people who are susceptible to it will get it. And it's not going to be the first time or the second time, usually it's third or fourth time, but it also depends how much time frame in between it has been. So anytime you get an antibiotic, theoretically you could have a reaction to it, so you do always want to watch for those symptoms. Just because you tolerate in the past isn't a 100% guarantee it's not going to all of a sudden be an issue.
Yeah, it's, when you have an infection, we try to treat you with medication or an antibiotic or an antifungal or whatever medication it is that is not going to over-medicate you or be too strong for what you need, because we don't want to, you can get desensitized to medicine too, right? Yeah.
Right.
So if we think we are truly allergic, do we need to see you to confirm that?
I think it's a good idea. And what happens is if you ask the general population, about 10 to 15% of people will report a drug allergy. And sometimes that may mean, well, it upsets my tummy. And other times that might mean, no, I got an injection with penicillin because I had strep throat in the emergency room, and then I woke up 5 minutes later covered in hives. And you want to separate those out and figure which of those histories reflects an actual allergy versus one that may just be a side effect. Because if you are using antibiotics that have too broad a spectrum or killing too many bacteria, for example, it's expensive for one, but you're going to get more side effects and more gastrointestinal illnesses with that antibiotic-associated diarrhea, C. difficile, for example, if you use something too big of a gun of an antibiotic per se.
Right.
And if you're someone who needs a lot of antibiotics, you might not have that one work when you actually do need it on down the road. You might have gotten some resistance.
I know it's a tricky situation where you're kind of caught between a rock and a hard place.
Right.
So I think the most common medication allergy penicillin.
It is, we would call it, broaden that category a little bit and call it beta-lactam antibiotics, and that just refers to the chemical structure of penicillin, but also it's an amoxicillin, an ampicillin, a part of augmentin. So that category of antibiotics is the most frequent antibiotic allergy.
Okay, and if it's the only, I don't know how many times I've run into it, but let's say for Mrs. Jones, it really is the best medicine and the only medicine that's going to target her particular situation. Can we still give it under very close inspection?
Sometimes that can be done, and it depends what the reaction was. There is another type of antibiotic rash we should talk about called erythema multiforme or Stevens-Johnson syndrome, where people don't just get hives, but they get a progressive rash. Hives will come and go over minutes to hours versus a rash that one spot pops up here and then another one over here, and they stay, and you're just adding spots to your collection, if you will. And then skin can peel. You can get mouth involvement. That is a different mechanism, and that's the type of allergy. If that has ever happened, we would never repeat that antibiotic because that would happen again. But somebody who has had anaphylaxis, again, hives, a few hours after taking it, wheezing, anaphylactic events, those, in most cases, you can be desensitized to the antibiotic. And that basically is a fancy way of saying start with a very small dose, and about every 15 minutes, every half hour or so, increasing that dose until you get to a treatment dose. And then you stay on that for as long as you need the antibiotic. Unfortunately, the effect is short-lived. It only works while it's still in your system. So after you've taken it 2 weeks for your pneumonia, if you need it again in a few weeks, you would have to repeat that desensitization process. It's not a long-lived protection, but it is a way to get people through that. And it's something we do that sometimes in the hospital. I've done it outpatient before with oral antibiotics. There are some infections that some antibiotics only work for, and you have to use them.
Do they need to carry an EpiPen?
I don't think in general they need to, because it's not that you're going to have exposure to amoxicillin randomly like you might have a food exposure at a restaurant. So I typically don't think they need to. There may be some severe cases or somebody at extreme risk of needing antibiotics that potentially could end up in an emergency room that maybe they should at least have a medical alert bracelet or something. So if they're found unresponsive or with people who don't know their whole history, that alert bracelet can advocate and say, I'm allergic to this. Unfortunately, healthcare isn't one unified computer system where if you tell CVS, your pharmacy, that you're allergic to antibiotics, it's not going to be in every computer system everywhere. So you still have to advocate for yourself, and in some of those cases, let other people know you've got those allergies.
That's a good point. If you do have a really true antibiotic allergy, you should wear that medic alert bracelet.
Wear a bracelet and let as many people know as they can.
In case something bad.
And your doctor may know and your pharmacy may know, but 3 in the morning in an emergency room in a different town, they're not going to know. So you have to have some way of advocating.
Yeah, that really is quite important because you don't want to have an allergic reaction and your mouth swell shuts on top of
whatever else is happening, right?
Right. Okay. So, classic. They come in and they say they're allergic to penicillin, but they can take Keflex. And then the drug, the pharmacy, when they go to get their Keflex, the pharmacist says, no, you can't have this. What's that all about?
So that beta-lactam type antibiotic, the penicillin group, there had been reports in the past of people with cephalosporin allergy, which is Keflex, a different category, had cross-reactivity. We used to think that cross-reactivity was as high as 20%. It's now lower, probably under 5 or 6%. So there are some cases where people can't tolerate both categories, but usually it's safe to try one of the cephalosporin antibiotics like Keflex with a penicillin allergy.
Yeah, and some people have different tolerances for risk.
Right. And it depends what you're being treated for. Is it something that, yes, we have 3 or 4 other antibiotics that aren't big gun antibiotics that can be used, so that may give you a little more leeway, or is there a specific infection? No. At this point, maybe the risk of that low risk of a reaction to the antibiotic outweighs the risk of not treating it or using a different antibiotic.
That's really interesting to know because sometimes antibiotics can be so expensive.
Yes.
Yeah, and if you have an allergy and then you want to take one and it's going to cost you at least 5 times as much as the other one, that's really unfortunate.
It is.
Okay. What about other manifestations, other ways that you know that you're allergic to an antibiotic?
So there are people who experience rashes later after taking the antibiotic, not that immediate reaction like anaphylaxis. It can happen several days into treatment.
Like 3 days.
And the classic story is, oh, we took it for 10 days, but on day 6 or 7 of 10 days, we broke out in a rash.
Right.
Usually that you can continue the antibiotic and just treat the symptoms in those cases. Sometimes you can stop treatment if you're far enough along and your doctor thinks it's okay. Sometimes that's a way to get around that, only treat for a shorter period of time. But that delayed rash typically is not going to be as severe, and usually you can treat through it with the symptoms.
So could they take that later on, maybe a year later?
Yes, and those you could repeat and do the same thing, just keeping a closer eye on it, making sure there's no immediate manifestation, immediate rash. But most of those patients can do that. And a lot of times when you repeat that, it doesn't happen the second time.
It's pretty miserable. I've had one, so
Yeah.
having that rash.
It's not fun. It's not fun.
Yeah, I could take a Brillo pad and just scrub my skin off.
Very, very itchy, intensely itchy. Yeah, your body's trying to fight it and get rid of it, and that's how it does it. So.
All right, so if sometimes the doctor will, and that's fine too, the doctor will say, well, okay, you can stop it. Mm-hmm. And then it generally takes, what, a week for the rash to go away, or?
It depends, because sometimes in those situations the rash is not from the antibiotic, but we think that it is, and we're going to do what's best for the patient and not cause further trouble sometimes. But sometimes that rash is because of the infection that you had, and that's very common in younger children. A lot of kids and even adults report this history. Well, I was a child, I had an ear infection, and some point in taking my antibiotic I got a rash. But that probably would have happened anyway, because it's the body's interaction with the infection and not the antibiotic that actually caused it. So, and that's why a lot of people get labeled as having penicillin allergy, because, well, when I was a kid this happened to me, but they probably really aren't allergic to penicillin. It was something else that caused it.
All right, so some very, very well-intentioned guardians, caregivers, treat an antibiotic for a common cold in the wintertime. Does overtreatment of antibiotics increase the possibility of becoming allergic to an antibiotic?
It does, and it adds to the confusion, because enough antibiotic virus situations, somebody probably will have hives from it. And if you take an antibiotic enough times, you can be allergic to it. So yes, so overuse of it does lead to it. But I will see patients that will come in with 3 or 4 antibiotics listed because they had an infection and they started with one and it caused hives, and they switched it 2 days later to a different antibiotic and they had hives again, so they assumed that antibiotic caused it. Then you're on your 3rd antibiotic. But the hive process continued, and the hives didn't really care what the antibiotic was because it was the infection that caused the hives. So you see that a lot, but that leads to a lot of confusion. And then that leads to the over-restriction of antibiotics, and then the more expensive antibiotics with more side effects, and it becomes a spiral.
Very good to know. Very, very good to know. All right, so what else should we know about antibiotic allergies?
Well, if you are someone who has a history of antibiotic allergies and you're not sure, if it was a very clear case, like, no, I took amoxicillin, immediately had hives and swelling, and I stopped it, that's pretty clear-cut and probably doesn't need much more evaluation. But if you're in the situation where my parents told me I had it when I was younger, I don't have records, a situation like that, and you're not sure, that's where we can really help out as allergists, because we can offer some skin testing for that antibiotic group, the penicillin group.
Perfect.
And then we can actually do something in the office called an antibiotic challenge, which very basically is, here, let's do a few doses of this antibiotic and make sure you don't have an immediate reaction. We do it in a controlled setting, small doses to begin with, somewhere in the neighborhood of 5% of a full dose, maybe even lower depending on the reaction, and do 2 or 3 doses in the office and make sure there aren't any immediate reactions, because we know the reactions that show up later, 3 or 4 days into it, are less of a concern. It's the immediate ones that we really worry about, and we can really rule that out and then open up the antibiotic category for you.
And I'll tell you, when you're able to provide that for somebody and give them peace of mind, that just is so, so valuable.
Right. It makes it a lot easier to treat a patient when you're not having to, really think about every antibiotic. Is this going to cross-react or not? Figuring out if they really do have an antibiotic allergy, and most of the time proving they don't. It just is a lot easier to care for patients.
All right. So some antibiotics give you side effects. Try to treat the side effect and push through finishing it if it's possible. Don't worry about taking it again. Generally, if you are worried, come see you so
Right.
you can challenge us. All right, so how do we get a hold of you?
Oh, we have several offices around town. 865-525-2640. And we've got, at this point, several physicians and nurse practitioners, all who can do the drug allergy evaluation.
And
So it's a
insurance
pretty
covers
standard-
it.
And insurance covers it. Yeah.
Excellent.
Yeah. And it doesn't end up with allergy shots. A lot of people are worried about that. It's
Yeah,
basically
I
just,
don't-
no, it's basically doing testing to figure out and then giving you the best guidance we can.
Oh, that's brilliant. Thanks, Dr.
Sure.
Singer.
No problem.
So glad for you to join us today. And that's a wrap.